My name is Matt Brady. I'm head of content healthcare with Informa Markets in Dubai, and I'm very pleased to be joined today by Tom Lawry, who's National AI Director for Microsoft, based in Redmond. Welcome to Omnia Health TV.
Well, it's great to be here. Thanks for having me.
Great. Well, I remember the last time I saw you, we didn't quite meet, unfortunately, but you gave a very stirring speech, and it was in February last year, and he came over to Dubai, and I remember very clearly this packed room, which I guess now might not be possible, but nonetheless, you gave this incredible speech about AI in healthcare, and I recorded it, and we developed a great piece of content for Omnia Health Insights based on it. Of course, much has happened since. It's been an astonishing 18 months or so since that talk. And much has happened in the world of healthcare, obviously, and much has happened in the world of AI. So, we've noticed how more businesses generally have embraced AI, particularly in healthcare. And so I guess, we can start by talking around, from your perspective, what has been the main change in terms of AI in healthcare? So, which sectors in particular have embraced it? And even in COVID itself, a COVID pandemic response, we've seen how AI has been used. But in what context, in what instance, and has Microsoft played a part in this?
Yeah, well, first of all, great questions. Going back to, a lot has changed since we were last all together for Arab Health last February in Dubai. And since then, we've seen an amazing number of changes in how health and medicine works, much of which has been driven by the pandemic. So, looking at that and maybe starting out at a high level, there are a lot of things that people are talking about surrounding COVID, but I think there are a number of positive lessons that are worth considering. The first is the pandemic basically showed all of us that when faced with the challenge, healthcare and clinical and business leaders are capable of agile transformation. So you look at everything that happened, the heroic efforts of clinicians and doctors, nurses, and others to really rethink how to provide healthcare. And so we saw things like the rapid adoption and growth of telemedicine and virtual visits. And these things show that healthcare is capable of agile transformation when needed. The second thing that, to your point on the questions, is the pandemic also demonstrated that AI, when done right, can produce rapid time to value. There are a number of cases that I can think about where, because of AI, we were able to respond much more quickly and effectively than had AI not been used. So a quick example is here at Microsoft, we have an industrial grade health bot. When the pandemic started kicking in, spring of last year, we basically took that bot and spun it into a COVID specific bot, put it out there for anyone. Hospitals around the world, Centers for Disease Control adopted it here in the United States, to allow anyone to address questions they had on their symptoms. And basically, this bot was used to triage tens of millions of inquiries of people from around the world to help understand what they might have or not have and how to triage for next best steps for actions. So you can only imagine tens of millions of worried consumers and citizens if they were calling in to a phone bank for humans to answer those questions. So one example of many when it comes to the use of AI to help assist humans in making healthcare better.
Okay, that's a very powerful example, the one that you just gave. Have there been cases of challenges implementing AI in healthcare organizations? So we see the value of AI in healthcare. That case study that you shared is a powerful, sort of validation or indication of that. But have there been major barriers to its adoption and use?
Yeah, great question. And again, I would say we've knocked down a lot of barriers in the last year at a much more rapid pace than had the pandemic not happened. Given the choice, I'd prefer the pandemic would not have happened, but it's just to say we've seen a lot of movement in the last year. Having said that, I'd pull back to say everyone's talking about artificial intelligence as we were in Dubai a year ago, as we are today. But it's important to recognize everyone's still early in that journey of using AI at scale in health and medicine. So when things are early in the journey, we're learning a lot still, including some of the barriers. So some of the barriers that we're continuing to see relate to things like people really not understanding what AI is or the value that's driven when properly curated in a healthcare setting. So we're still hearing people talk about AI as a replacement for clinicians. And anytime I hear that, I first chuckle, but then more importantly, to me, that's a measure that whoever is saying or writing about that probably doesn't understand really the value of AI itself. So if there's anything that one would remember about this conversation, is AI only adds value in one of two ways. It doesn't matter about the technical side. You don't need to understand any of that. It adds value by automating the way work is done or augmenting the way work is done. In automation, these are typically job types that are highly repetitive in nature for what the work is, not a lot of variance, not a lot of problem solving. So most of the jobs in healthcare, though, are not jobs like that, but rather they're jobs done by knowledge workers. So again, clinicians, finance specialists. And this is where AI is not going to replace those people. It's going to augment. It's going to take something they're doing and be a tool in the hands of those knowledge workers to make them better at something they care about. So when you look at this, we're increasingly finding ways of bringing AI in behind these talented knowledge workers to improve the way they work today, or to start solving problems that before we didn't think were solvable. So those are some of the things we're seeing. I believe we'll look back even 2 years from now and kind of chuckle at some of the use cases, because it's just going to keep getting better in terms of our ability to solve bigger, greater problems in healthcare.
So this is a common misconception I've been seeing myself, and it's come up again and again in the media, this fear that AI and automation generally will supplant or replace professionals across different sectors and not just healthcare. And again, I've spoken to many professionals like yourself, people in healthcare, clinicians and physicians and so forth, who have basically said, well, actually, AI is an ally. It's not a threat. It will enable us to do our jobs properly and treat patients, which is in effect what we're in a profession to do. So on that basis, how do we ensure that there is better education in healthcare so that people are placated or they're not too overly concerned about their position in the healthcare system?
Well, and this is where I always start with, the technology is not easy, but almost the easier part to drive value. The larger change to me starts with what I call the leadership imperative. Many times we see great clinical leaders, great leaders running hospitals or health systems who, when they hear about AI, they kind of automatically do, well, that's for my chief technology officer, that's for my chief data science team and officer to be dealing with. And so much of this, back to how AI drives value, is all about improving things like clinical and operational workflow. So our ability to do that is driven off of the best experts are those on the front lines, on that sharp end of the stick right now, providing care and delivering service. So much of this is human driven. It starts with recognizing what AI can do well and what it can't do well. It's bringing forward coalitions of your workers, your clinical staff, to start having them be the ones that are really looking at AI, how to bring it into the organization, how to define use cases that are great starting points to demonstrate the value. And along the way, this is where you're creating this this culture that is very focused on AI to improve these processes rather than paying attention to the technology itself. And this is where many times organizations get the technology plan right. They don't necessarily get the people plan right. They don't bring the clinical leaders along in a way that they are clearly, their hands on the steering wheel, they're helping to drive it. And this is where it's what I call when AI meets HR conversation that really is critical to the success of any organization when it comes to taking AI, driving value at scale.
I'm wondering if training can help or play a role in all of this. We ran a survey recently of healthcare professionals around the world. It's our annual survey, and the purpose of the survey is to uncover sentiments in the healthcare industry. So, what are current attitudes towards technology, including AI? And it found, and I'm just reading this point here, that there was a notable increase from our previous survey, which was ran prior to the pandemic, in terms of the proportion of staff trained to use AI in organizations. So there are more people trained to use AI, but there's much work that remains. So in other words, some 50% of organizations in healthcare still don't have staff trained in AI, which strikes me as a huge opportunity, given that more organizations are expressing interest in AI. We're obviously seeing the impact of AI. How do we redress that deficit, that gap?
Yeah, well, first of all, let's point out the fact that if your survey shows 50% have been trained, that's great progress compared to even a couple of years ago. So
Right.
that's a great stat. Again, I bring it back to everyone's early in the journey. Now, to your point, how do we fast forward to really bring AI into play in a way that helps solve our biggest challenges, and whether they're improving health and medical care, or whether it's doing things like reducing burnout that clinicians around the world are feeling because of all of the pressures they have. And those things are only getting worse. We only need to look back at the past year to look at, again, the Herculean, tremendous heroic efforts of clinicians who really saved the day when it came to the way they did the pivot, the way they committed themselves to working to not only take care of COVID patients, but take care of all those other patients whose conditions were still there. So, training is critical, and training doesn't mean, teaching someone how to code, how to train an algorithm. And it's much more so understanding, again, what AI is, and particularly in the context of what it is that a person does. So, pre-COVID, I had the opportunity to be doing a lot of executive and clinical leadership training on AI. And many times when we talk about that kind of training, it's helping them understand what it is, how it applies in a health and medical situation. And sometimes it's things as simple as an exercise we would take clinicians through to be able to say, you don't need to understand machine learning. But if I were to say to you, what are the what are three things that if you could predict would make you better as a clinician or the work you do? And getting them to think about less the technology and more how to apply it in service of their practice is really a lot of what that training is about. Because if we can define those things, then we can bring teams together who do have the skills in AI, in machine learning, in algorithms, to put that in and behind those clinicians who are doing great work today.
Okay, that makes sense. What is Microsoft currently doing in AI and in healthcare? And where do you see yourself in the months ahead? So AI as a discipline is changing very quickly. I saw a series of news mentions surrounding the acquisition of Nuance. Would you be able to elaborate more on what Microsoft is currently up to?
Yeah, well, at a high level, the really great news on AI and why it's becoming such an important topic is, almost on a monthly, quarterly basis, we're seeing more things reach human parity when it comes to functionality of AI. So vision, speech, knowledge extraction. So if you look at who's getting to human parity first, most of the time it's Microsoft. Now, others skid across that finish line right behind us, but it's to say we're making huge investments in taking this farther, and not just in the experimental stage, but reaching human parity, number one. Number two, making these things available as industrial strength components that can be applied in the real world today. So a decade ago, there might be things that could be done, but only in the lab. Today, these are all commercially grade components that can be applied for problem solving in health and medicine and all the other segments. Your mention of Nuance is a great example. Nuance is the leader worldwide in the use of conversational AI in health and medicine. So I want anyone thinking about their experience when they go in to see their primary care doctor. Typically, when I go to see mine, who's a great physician, the only time they really look me in the eye is when they're walking in and saying, "Hi, Tom, what brings you in today?" After that, what do? They typically go to the corner of that exam room where there's a computer. They stare into the computer. They hunt and peck as they look up your medical record, ask you questions, but they're looking at their computer screen, not at the patient. So Nuance has this great program with conversational AI, which is powered by a lot of Microsoft componentry, that allows a doctor to sit there and actually look me in the eye as a patient and have a conversation. And as they're asking me about things in the background, there's ambient intelligence. It's recording what's being said. It's starting to then triage all of those things that normally you would be putting your hands on the keyboard to do. It's helping to come up with those initial triage notes on an automated basis that are fully editable by humans after the fact. But it's allowing physicians to do what they train to do, which is look a patient in the eye, have that conversation, have more empathy as they're going through this, and actually then improves their ability to do that. And at the same time, we're reducing the reliance on having to do things like keyboard. So many times I have the opportunity to talk to physicians, and they feel like increasingly with all the changes, they've become more data entry clerks than physicians. So Nuance in Microsoft is helping by taking this one thing, conversational AI, and allowing that to make physicians be better at what they went to medical school for.
And this is really what it's all about, isn't it? It's lifting that burden, enabling or empowering physicians to do what they want to do, what they've always wanted to do, which is to serve
what
the
they
patient.
want to do, what they do, making them better. So we're seeing a lot of things, for example, on one of the hottest areas right now is basically intelligent imaging. So you look at all of the things we can now stitch into images to help radiologists, pathologists by doing what I call pre-reads. And again, the idea here is not to replace a radiologist, but if they can get through more reads, they spend less time in front of those screens looking at images, and much more time either conferring. I mean, radiologists are some of the top experts when it comes to conferring with all those other specialists who count on them for their advice, their wisdom, and their guidance. Or, it may even do things like allow them to have more time to do research, or better yet, maybe even be home a little more often to have dinner with the family. But it's all in service done right in how to make medical care better by empowering humans. And every time I see AI represented by a robot, again, I chuckle because it's not about making it less personal when it comes to medical care. It's actually about making it more personalized for the consumer, better empowerment for those clinicians to be able to do the things they really care about. And to me, that's what Microsoft's all about when it comes to our push for AI in health and medicine.
And that's a very powerful key message, and I think we can all agree with that principle. Looking ahead into your crystal ball, in a few years' time, when hopefully all this is over, the current pandemic, and we're all meeting physically again, what's your vision of AI then in healthcare? So what kind of artificial intelligence can we look forward to?
Well, I think it's going to be as pervasive as it seemingly is now. I think it's going to become much more pervasive. I also think it's going to become much more ubiquitous when it comes to, we'll probably be talking less about it just because it's an everyday part of what happens in health and medicine. So it'd be interesting to say how many how many people today think about and talk about how your smartphone works? I mean, you just kind of use it. There are many apps, and I see AI becoming much more like that going forward. Where if we were to first walk through a major medical center a couple of years from now, the majority of the systems we have today, whether it's electronic medical records, diagnostic imaging, all of the patient administration systems, they're just going to become much more intelligent to the point where, it's kind of like what Nuance does. It's ambient. It's part of those systems, and everyone knows those systems are going to be much better because of that. The second thing is, I think it's going to empower everyone to look at different models for care. All we need to do is look at the last year to look at the tremendous boost telemedicine and virtual visits got. And that's just going to keep occurring. Much of that, again, is going to be driven by intelligence underneath. So I think about this concept of care anywhere, the hospital, the home, when you're in transit with, portable devices like smart devices that are helping you monitor, for your health or for a medical condition. But it's going to allow us to have more of this care anywhere. And it's going to be much more prescriptive, because if I have the ability to predict things instead of just look in the rearview mirror for what happened, it allows us to be much more prescriptive on things like ways of optimizing to stay healthy, or if you're someone with a chronic condition, being able to have greater tools available for you to manage whatever that is, your diabetes, your COPD. So all of that is going to keep getting better, more pervasive, and probably less visible as it is today, since, again, we're very early in the journey.
Well, that sounds amazing, and it's a future that I think we can all look forward to. I certainly see its benefits and how it can transform healthcare for the better. So on that note, I think we need to wrap this one up. But thank you very much for your time today, Tom. It's really fascinating to.
Well, it's great to be with you virtually, and hopefully in the not too distant future, we'll be back together in Dubai for the next conference that you're putting on.
I hope so. I hope so. It's it's coming soon next year. So fingers crossed. See how it goes.
Absolutely.
But in the meantime, continue to stay safe and stay well.
Thank you. You too.
Cheers, Tom. Thank you. Take care now. Bye.
Thank you.